In 1954, doctors performed the first ever transplant of a human organ to another human, and it was the kidney. Ever since then, transplantation technology has been evolving more and more, up to the most recent eye transplant. Hello Homo sapiens! In this video, I'll be talking about the transplantation of the kidney. The kidneys are two bean-shaped organs that lie just below the stomach on either sides of the body. These two organs have a function, which is to convert urea, which is a byproduct in the blood, into urine, a more stable, non-toxic liquid byproduct that can be easily excreted out. Sometimes the kidneys will stop functioning, either due to trauma or, more likely, end-stage renal disease. End-stage renal disease is a disease that causes the kidneys to stop functioning. Symptoms may include jaundice, lack of urination, dizziness, and nausea. If allowed to progress, this disease will eventually kill the kidneys. So, the doctors invented a solution, one of which is dialysis. Dialysis is basically doing the kidney's job for them. When dialysis occurs, a machine is linked to the body's blood vessels, and it will serve as a mechanical kidney, filtering the blood. However, this is costly and very painful. The patient must do this around 3 to 4 times a week to keep their blood clean, which is very traumatic for the skin because it is repeatedly poked and prodded by the needles. So, doctors invented another solution: kidney transplantation. Kidney transplantation is actually the most common transplantation surgery on Earth. It does not serve to replace the old kidneys, but instead, it just slides in a new one underneath the original kidneys. After the kidney is slid in, it will be allowed to acclimate to the body's temperature, and after that, its blood vessels will be connected to the right vessels, and its ureter will be directly connected to the urethra. Once that is done, the patient will be stitched up and be placed on anti-rejection medication so that the new body does not reject the new kidney. Aww. This procedure has saved countless lives, and it has become the groundwork for future surgeries, though it does not come without its drawbacks. For example, the wait time between being put on the waiting list and entering the OR can be quite long, ranging from a few weeks to months to years. It can take so long to find a suitable donor that the person just dies before they can get a kidney. This is true for all major surgeries because the demand far outweighs the supply, and we don't have enough organs to go around. And finally, it's important to remember that kidney transplantation and all transplantation is not a cure, but instead, it is a lifelong commitment, a commitment of rehabilitation and immunosuppressant drugs. But in exchange, you get to live a longer, healthier, and fuller life.